Hi, I'd like to talk to you today a little bit about what autoimmune is. What is an autoimmune disease? How did it come to be that you are thinking that maybe you are suffering from something autoimmune? Let's first start by the definition of what autoimmune is. So auto means self. So self and immune system. So that is where an autoimmune condition is, where the immune system starts attacking you. It starts targeting cells and attacking your own body parts. Now, depending on what area those cells are being marked on and the immune system is attacking is going to depend on what disease label you get labeled as. So, for example, if the immune system is attacking your thyroid, you may have been labeled with a diagnosis called Hashimoto's disease or Graves' disease. That is where the immune system attacks the thyroid, and we consider those autoimmune thyroid conditions. If your immune system is attacking your joints, it's called rheumatoid arthritis. If it's attacking your vascular, which is your veins and your arteries, that's lupus. If it's nerves, neuropathy, there's a ton of people suffering from neuropathy across the globe that doctors simply don't know what to do with if it's not caused from diabetes. So a lot of people have nerve issues and they don't think of it being as an autoimmune condition, but that's definitely something that should be investigated, because if the nerves are being attacked, the symptoms are gonna be neuropathy, which is pain, numbness, and tingling. In the brain, if the cells are attacking brain tissue, we're dealing with conditions like MS, Parkinson's, Alzheimer's, things that are, very life-changing for people. These diagnoses are being overlooked as that autoimmune component. In the stomach, it can be colitis, Crohn's disease. Those things are affecting people across the globe as well. And a lot of it is your own immune system attacking yourself. And a huge one is the pancreas, type 1 diabetes. When the pancreas gets attacked by the immune system, type 1 diabetes is what can ensue. So these are all just conditions. There's over 190 conditions right now that can be classified as an autoimmune conditions, and more are being added every day. So we're really starting to see how the immune system attacking itself is contributing to a lot of these disease process and symptoms. So you might want to know now that we see all these different diagnoses and all the systems that it can affect, well, how did I get an autoimmune disease? Why is my body attacking itself? So the answer comes down at the cellular level. So we all have cells in our body, okay? Cell membranes, and in every cell, it requires energy to operate and function properly. So no matter what organ it is, wherever it is in the body, our body parts are all made of cells, and those cells have to function properly, and they have to look like a healthy cell for our immune system to not want to attack it. So a good healthy cell is going to be nice and round, not misshapen or misformed, a nice solid membrane. Okay, so what happens in an autoimmune condition? Why do these cells get tagged? So the first thing can be energy. So if we don't have enough energy, so an energy can be in the form of food, it can be in the form of vitamin and minerals, it can be affected by what we're exposed to in our environment. Those energy type symptoms are going to be the energy going into the cell is not going to be good quality energy. So if it can't get in, gets deflected away, or we just have less of it. So we have less energy going into the cells. That can cause these cells to start looking misshapen. Okay, so that's the first signal. The immune system's like, whoa, there's something going on here. That cell doesn't look like the rest of them. So right there, it may get a mark. Okay, the second thing that may happen, we have toxins. As our cells use energy, it builds up toxins in our body. So those toxins have to be able to exit the cell. If they can't get out, either because it's already misshapen, or we have so many that we can't detoxify and those toxins start to stay in the cell, well, that also will cause the cell to not only be misshapen, but to be full of toxic debris. So now if you're an immune system and you're looking for these types of cells and giving those a check, well, guess what happens when you get to these? Those get flagged And that tells your immune system, hey, those aren't supposed to be there. They don't look like the rest of the cells. And that is where the attack and where autoimmunity comes from. So in a simple form, too little energy in and too little toxins out can definitely contribute to that autoimmune condition. Now, of course, there are many things that go into where the energy comes from. How is it utilized? How do we get it? How do we make it good energy? How do we get good quality energy? And how do we get the toxins out? How do we detoxify those cells? So those treatment options are going to come based off of this premise of making every cell be able to work properly. So we want to make sure we get good energy in. Now, energy is not, we're not just talking about supplements. So yes, good high quality nutrition, good supplementation for things that your body are lacking are definitely ways to get energy, energy levels up. However, if the cell membrane is not receptive to the energy, it can get deflected there. And then guess where all those supplements you took go? Down the toilet. Your body can't use them. They can't get into the cells. So I've seen time and time again people coming in, well, I've taken all these supplements. I've read all of these things on all of these different, they come in with bags full of supplements saying, but I take all of these things. I have to be healthy. If your cell cannot utilize those supplements, you are simply flushing them down the toilet. So it's very, very important to understand that the energy in the cell has to be able to be utilized for it to be effective. The second part is going to be detoxification. There are many different ways we can detoxify the cell and get this border cleaned back up again and get the cell transitioned back to a healthy cell again. So in our office, we utilize, we do use some supplements, high quality supplements combined with technology. Technology meaning things that actually change the electrical current and magnetic field of the cells. This actually allows the cells to plump back up again in as little as 1 to 2 treatments. We can actually start seeing changes at the cellular level. So I encourage you, if you are suffering from something that even remotely looks like an autoimmune disease, suffering from something you haven't had a good explanation as to what is causing it, and it hasn't been investigated if it's autoimmune, I strongly encourage you to come in and speak with one of our providers, to come in and let us take a look, let us run some in-depth lab work to evaluate if possibly what you're suffering from is something caused by your own immune system attacking itself. The only way you're ever going to be able to get out of those symptoms and to get those symptoms improved is to change the cellular energy in your cells. No matter what medicines you take, no matter how many supplements you throw on there, if you don't fix how your body is able to use them, your symptoms are never going to get better. So I strongly encourage you to come in, let us talk to you, let us take a look at what you've gone through to this point and what your symptoms are, and see what program we may have to help resolve some of those. Thank you.